Hello, welcome back to my lecture. This is the last session of my lecture, session 8. Right, we continue. This session is communication in geriatric patient and in angry patient. First, about geriatric patient. The characteristic of geriatric patient, there is a hearing problem. Sometimes the patient needs a hearing aid, and sometimes sensitive to loud sound. So that's a situation where you have to know that you don't have to shout on this type of patient, geriatric patient. There's will be a condition of impaired thinking process, need more time to understand. There's a short-term memory problem to recall, lack to focus or concentrate in a short time. Also, there may be a vision problem and a difference in perception and values. This is what we know as generation gap within the health providers and the patient who is a senior citizen. Also, there is a psychosocial factors. The patient has no more activities, no work, loss of friends, and no close family members. And how do you do effective communication in this geriatric patient? You should have an adequate distance, not too far or not too close. Too far, maybe the patient can't hear. Too close, there'll be a distortion of the sound and also a problem of seeing the doctor. An adequate distance about 1.8 meters. You have to sit in front of the patient with the light in front of you. So the light is coming in front of you to show your face. So your face can be clear, shown clear. Your expression, your mouth, your movement of your mouth can be seen clearly by the patient. You have to speak clearly with clear movements of your lips and mouth. So that's why there should be a good light in front of you, showing your face, your mouth. No shouting, and don't speak directly to the patient's ear because it can distort the sound. You may touch the patient to attract attention. Use a simple, short sentences. Don't use a long sentences, long information. If there's a long information, we have to cut the information in parts and then give information step by step. Avoid noisy room. You have to be a private room where there are no disturbance. And you should understand the patient beliefs and values because maybe these geriatric patient, senior citizen have different values, different beliefs than you. So remember the old generation versus the millennial generation. That's about how to communicate with geriatric patient. Now we talk about how to communicate with angry patient. This is a very bad situation or situation where doctors don't want to handle or manage a patient who are angry or the family members who are angry. Patients who are angry may be because what the patient did or did not do, what not expected by the patient or family member, lack communication or lack of information. And the patient may have emotion feelings of disappointment, or frustration, depressed, and also denial of his or her condition. the physician, how should the physician handle this situation? Or the doctor, keep calm, don't be provoked, keep always a distance, don't get close, because an angry patient can sometimes make physical violence, physical a threat to the doctor. So you have to keep a distance to keep safe from the patient, from the angry person. You don't know how, what he will do, so you have to keep a good distance. Don't try to get closer or touch the patient, because getting close to the patient or touching the patient may consider as a threat to the patient or to the angry person. And you might invite the patient to a more private area. If the angry patient is in a public area, you might invite him or her to a more private room, so you can discuss it more privately. Always aware of a potential threat, ready to avoid any assault, physical threat to you. Let the patient express his or her emotion without interrupting. Only speak or answer questions when required. So when the patient or the angry person is shouting, speaking his emotion, his expression, let him finish what he wants to give, what he wants to deliver. Let him finish. If the patient stops, then you can ask him if is there any other things you want to deliver or say. Let him express until he is finished with all his emotion situation. Then you ask him or her if you may answer his questions or his hopes. So I think that's just a brief brief guidelines how to communicate with a certain situation patient, an old patient, geriatric patient, and an angry patient. In the next weeks, you should search more in details about this situation. So you can read the first session again until the 8th session to get more clear knowledge about health communication, effective health communication. As the last slide, I just want to remind you that every person needs to be heard, needs to be listened to, and needs to be understood. So this is the 3 statements that you always remember when you are communicating with your patient or with someone else. Thank you. We have finished my opening lecture in effective communication. Hopefully you can understand and use this lecture as a reference to find more details, knowledge details, materials about the effective communication in health communication. Thank you very much for your attention.